Hello, and welcome to the Functional Nurse Academy podcast. This is your host, Melissa Schreibfetter, owner and founder of the Functional Nurse Academy.
Welcome, everyone. It's so great to be here with you all. I have another wonderful guest lined up. There are so many different specialties within healthcare. And as you all know, as our listeners know, the nurses tend to be the loudest about speaking up about things. But I was blessed to find a pharmacist that is speaking up about these really, really important issues. And I have always just been so curious about the things that are going on in healthcare, the controversial things going on in healthcare, such as things like aluminum, Tylenol usage in pregnancy, and the ingredients in vaccines and how that can potentially negatively impact the body. And I think it is great to have a perspective from a clinical pharmacist. Our guest today is Michaela Wachal. She is a clinical pharmacist, devoted wife, and mother of 3 boys, and her journey into functional and integrative medicine began when one of her children, who lives with autism, ADHD, and anxiety, experienced worsening symptoms on psychiatric medications. Determined to find a safer and more effective path, she partnered with his psychiatrist to discontinue the medications and immersed herself in research on nutrition, supplementation, and holistic approaches. She is currently completing a functional pediatric psychiatric fellowship with Dr. James Greenblatt, and through dietary changes, gut support, detoxification strategies, and targeted nutrients such as magnesium, Michaela has witnessed a remarkable improvement in her son's health and well-being in just under a year. Inspired by his transformation, she now shares her knowledge to support other families navigating similar challenges and to advocate for personalized root cause approaches to pediatric mental health. Welcome, Michaela. It's great to have you.
Hi. Hi. Thank you so much for having me.
So, to our listeners, before we turned the camera on, we were chatting, and I was telling Michaela, I was like, oh my goodness, like you are a pharmacist that is speaking out and you're studying to learn functional pediatric psychiatry, which is such a need right now. And I actually, my first job was in peds, but I couldn't
Oh,
stick kids, so I had to get out of there. And then I also worked in psych, and I was so heartbroken by how behind the medical system is in
yeah.
psychiatric care. And I think I would love to hear a little bit more about, you being a conventionally trained pharmacist and then kind of having this awakening through helping your son with complex issues. What was that journey like?
Yes. So, like you said, I've started diving into independent research because I finally said, it's been almost 8 years in this journey. We've done all the things, all the therapies, medications, trial after trial of medications. And because that's what our system does. And as a pharmacist, that I knew what I thought was best was doing the medications because as a pharmacist, that's what you don't know any different, right? And those are the guidelines and recommendations. And wouldn't a psychiatrist see tons of patients like my child to know what works and what doesn't work? But it got to a point that we didn't even know which meds were helping, which meds were causing side effects or weren't helping. We really reached a point of crisis where we had to transfer my child to a specialized school. And we even had to consider a psychiatric institution. And I am sorry, I'm going to get emotional talking about it because this was just a year ago. So it's been a big transformation in just that time. Um, but I'm so grateful that I didn't give up and I kept fighting. And that is one message I would give every parent is to keep fighting and you keep advocating for your child because there's maybe not one thing that is going to work, but you got to try something else. And so what I finally realized is that our health system in the entirety wasn't working. It was failing my child. I mean, we went to multiple specialists, neurologists, psychiatrists, therapists, a ton of different um, about everything probably that you can imagine. But I'm just so grateful that I didn't give up. We got him in a very good school that has great support and really provides a not only that supportive structure, but helps them feel safe. And that is so important. I got my son off all those medications in the next 2 to 3 months when I just decided, we don't really actually know how many of these psychiatric medications are working. And my child's really being a guinea pig. So I got him off so we could kind of start fresh. And along with that, then I started learning functional medicine. This whole other world that you don't learn in pharmacy. You don't even hear about it. It actually, it's more quackery that you're taught about. And actually that most herbal supplements and things like that that you don't want patients on because it interacts with the medications. And so I think a lot of pharmacists don't view those openly because of those concerns, because you're dealing with medications and those interactions. But when I started seeing this whole other world, I just realized, what are we doing? We're not using all these tools that we have. So let's use these other tools and see what happens. And so I did, and I started, we started focusing on gut health and mitochondria dysfunction and oxidative stress, brain inflammation, and just different things that I had researched and felt comfortable with, including, the omegas and acetylcysteine and magnesium. Um, what else? Yeah, things, just multiple different things to support the gut, prebiotics and probiotics, so inulin and then specifically bifidobacterium and lactobacillus. So things I had done research on. And then while I was doing this and while I was learning, I wanted to share it with everybody because it's so critical for these for these families and these kids to get help. And I was fortunate enough that I have the education and background and resources that I was able to, do the different therapies and things like that and figure some of this stuff out. But many kids and families aren't in that situation. And these are the kids that end up, going to psychiatric institutions or eventually being in group homes. And um, I just feel for them so deeply. So I wanted to share this information or education as I learn and as I go to really make a difference and try to help others, since the system in its entirety isn't doing that and it's really failing these families.
It is, and it's very sad because there's so much suffering that comes about this, and then also a lot of these medications that are being used in the pediatric population, many of them have actually never been studied in the pediatric population, and there's a lot
Or
going.
together in combination. So they're usually end up in multiple medications. You maybe have an antipsychotic um, and antidepressant or an anti-anxiety medications and a stimulant, and they're all being used together, but we don't have the studies to show how those affects how that works together or what the repercussions are. So there are a lot of issues with how we view or how we utilize pediatrics. And not that they don't have their place. There are many medications that help a lot of children. Stimulants can make a difference. But should it be first choice? Should that be what we do first as a first introduction to our children? Or should we look at safer alternatives that don't have the necessary long list of side effects and long-term consequences that we don't necessarily even know, um, and start there? I mean, it makes a lot more sense to focus on things like nutrition and then supplements and then move to medication. So that's what's kind of my experience and how I view it, as not necessarily that they don't have their place, but we need to look at alternatives as first line.
Yes, and on this show, we talk consistently. All of us nurses that are here on the Nurses Report show, we are always talking about informed consent, risk
Mhm.
versus benefit analysis, and so much of that is left out in this conventional model. And again, with on the functional medicine side, something else I've been screaming from the rooftops is we know this is well known and it is in the published literature that on average there's a 17-year time lag from when we discover a new concept to when it gets implemented into the standard of care. But the thing is,
Mhm.
because we have corruption in medicine, if this is something that is working, but it may be a threat to pharmaceutical industry, there's going to be so much pushback and it may never be implemented. And
Yeah.
I think this is such an inspiring story because I think with our listeners, if we don't have someone in our family or someone that we know that is suffering from some type of chronic issue, you likely know someone that is. And I think it's very
Hmm.
hopeful knowing that there are options outside of what is in that conventional, what the conventional medical model can offer us. But one question I like to ask some of my guests about these stories where we hear about all of this amazing healing. And I think that that is remarkable that through all of your hard work with your son, that you've got him, you were able to get him off of these medications safely. And you mentioned that he had remarkable improvement
Hmm.
and in under a year. So, like, if you had to put a number on it, like, how much of a percentage improvement have you seen? Are we talking like 50%
Oh,
or more?
I mean, he is a typically developing child where you would have no idea. Like, he's playing sports, he's in school, he's doing academically well, which we had a big gap in education because he was previously put in basically a room by himself because of behaviors where he wasn't able to learn for a couple of years, really, and because of emotional dysregulation and focus. And now he's thriving. He has I pretty much closed that gap. And we don't have behavior concerns, don't really have any. I mean, which is weird when you're so used to walking on eggshells and being worried about the day to day or how to handle a situation because of the emotional dysregulation and behaviors and aggression. That's hard to kind of step back and realize, like, oh my gosh, this is our reality now. Like, I don't have to live in that chronic stress and that chronic fear because he's doing so well. Now, I mean, I'll always be a little concerned and worried because I know that we'll have to support detoxification and those things. And if if the toxin burden increases, how's that going to affect him? So I mean, a lot of it's we don't know, the future, what that looks like, and with hormonal changes and all the things that, how to we'll have to navigate. Um, but I just, yeah, in less than a year, I just never expected to be where we are now.
That's so wonderful. And I love that you mentioned detoxification. And another thing that functional medicine has been screaming from the rooftops about psychiatric disorders is that there is a massive inflammatory component. Many of these
Mhm.
individuals are having impairments with their detoxification pathways. And one thing I hear conventional medicine saying, they're like, you don't need to detox. That's why you have a liver and you have kidneys. And I'm like, yes, we have these amazing organs of detoxification, but we are exposed to things that we should not be exposed to. There's a variety of
Exactly.
toxins we're exposed to. And then when we talk about heavy metals and what really caught my eye about the amazing content that you are covering on social media, and you're the only pharmacist I know of that's doing this type of content. You were speaking up about the the high levels of aluminum that are present in vaccines. Could you speak to that?
Absolutely. And I don't know if you want me to kind of talk about how I got into that actually. And I guess what I wanted to say is that with pharmacists, you're not going to have a lot of them speaking out or realizing that there's something to speak out on because they really believe they're doing the good work. They're helping people and they trust the people that provided their education and the guidelines and the resources. And until you realize that there's corruption, it's hard to see it. You have to see it for yourself. But back when I got my son off medications, at that point, I had already heard a lot of stories about vaccine injuries and autism. But of course, as a pharmacist, I just brushed that off because correlation doesn't equal causation, and there are so many factors. And vaccines save lives; they've been around for years, and about safety studies, all the things that you just spew off as a pharmacist, as it's like mantra. And that's been, it's been debunked because, you know, vaccines don't cause autism, and that was just Wakefield. And the guidelines we follow are prestigious organizations. these are full of experts that are evaluating the science. So who would I be to question, the World Health Organization or CDC or FDA, American Academy of Pediatrics, Institute of Medicine? That's way above me. But then I said, I'm going to prove myself right. I'm going to look into this. And yeah, I was so wrong. And not only do we not have true safety studies in the vaccines on the child health schedule, all these organizations are full of conflicts of interest and corruption. And that's just something you don't think about because you think that'd be like the number one rule: no convoluting in government, no conflicts of interest between at least government and pharma. But now I realized that was pure ignorance. And I think this is how, though, much of our health professionals think, and they trust these organizations. So one of the first organizations I looked at was the World Health Organization, and they had noted concerns of safety vaccines, I think in 2024. And come to find out, they really did nothing about it. Like, they noted that there was concern. Time goes on, nothing. They have this big vaccine safety meeting in 2018, funded by Gates, and then and you would think like adjuvants would be a big major concern for that topic, but it wasn't even highlighted. So through that and seeing that, there was concern that they didn't do anything, dove more into the studies, and I started looking for the safety evidence to support, is small amounts of aluminum in the vaccine safe? And there wasn't evidence of the safety. Not only that, but there was tons of evidence demonstrating harm, like potential harm, because it's a toxin. It's actually a well-known toxin, and it's a neurotoxin. And actually, if you do a PubMed search for aluminum and toxicity, you get over 9,000 results, which is wild to me. So of course, I couldn't read all the studies, but I just kind of started diving into these studies and what they're saying about aluminum. And I mean, even the American Academy of Pediatrics says that the blood-brain barrier in an infant is immature, as well as the renal function. And so, you think about that, increasing the risk from aluminum, just from IV formulations. Okay, so one of the studies I found that started kind of the whole amount of what's safe in vaccines was looking at aluminum in the infant parenteral nutritional formulations. Okay, and so the FDA recommended limit for aluminum is actually a daily limit. There actually isn't any, which is surprising. But parental nutrition, the limit is 5 micrograms per kilogram per day. And then for like the parental products, it's 25 micrograms per liter. So they do have regulations on that, and you can find that in the Code of Federal Regulations. Okay, so then if I go back to where that limit comes from, a study that was done in 1997, and this is published in the New England Journal of Medicine. It showed aluminum neurotoxicity in preterm infants receiving IV feeding solutions compared to standard IV feeding solutions, and then they depleted aluminum depleted solutions because there was higher concentrations in the IV feeding solutions. Okay, so what they found, though, is that increased aluminum exposure was associated with reduction in the mental developmental index. Okay, so there was a major finding there, and you would think because of that finding, we would study that more. Like, hey, let's look. There's a major concern here, a red flag. We see an increase in, in mental health and neurotoxicity. Let's look at this. But they don't. There was really like nothing afterwards. And so all we have to go off of is this 5 micrograms per kilogram per day. So I thought, okay, well, I'll just look at that amount, and then I will compare it to what's in the vaccines, like what amount of aluminum is in the vaccines that we're getting, compare it, per weight. And so if you just look at Ritonavir, which is the hepatitis B vaccine that's given at birth, this contains 500 micrograms of aluminum. And then you think of the average weight of a newborn, and that's about 7.5 pounds or 3.4 kilograms, okay? And that ends up being 147 micrograms per kilogram at once, which is 29 times the limit of that 5 micrograms per kilogram per day limit. And so that was just like just an alarm, a major alarm of why we have such higher amounts of aluminum in vaccines when you're comparing intramuscular. First, that limit was set on IV parenteral nutrition, but IV and intramuscular have, about 100% bioavailability, meaning that's what gets into the blood to be distributed throughout the body before it's excreted. Meaning, if it's in your blood, it can go accumulate in different organs and tissues, and aluminum can accumulate, or it's shown to accumulate in the bones, in the brain, in the lungs. So then I really just got diving into aluminum.
Yes. Well, it's such a big deal, and this is really one of my pet peeves as I have entered into functional medicine, because this area of vaccines and talking about aluminum, because there are aluminum adjuvants in vaccines, I found that there's so many educational programs that will not touch this. So then we have these functional medicine practitioners who are supposed to be the alternative, but they will not touch anything to do with vaccines. And, if individuals are injecting things into themselves that have not been properly safety studied, and especially known neurotoxins such as aluminum, that is something that should be evaluated, and we should be
Yeah.
educating them about this. But that's something else I teach about, because the FDA does recognize the safe limit of aluminum in humans as 5 micrograms per kilogram per day. Now, when we have a newborn infant, say an average newborn is 8 pounds, that means they should receive no more than 18.18 micrograms per day. And that hepatitis B vaccine, which again, I covered that last week, guys, but I was very thankful to see that removed from the universal recommendation. It just was a nonsense recommendation, because it's a very high risk vaccine that has not been properly safety tested. That far exceeds that. And then moving on, when we talk about the 2-month visit, okay, they receive 1,225 micrograms of aluminum. And then they continue to receive doses of vaccines throughout childhood that contain this adjuvant. And by the time, and now this data I have is with that hepatitis B vaccine included at birth. Within 18 months, they are receiving 4,925 micrograms of aluminum. That is very serious, and something that I would love to hear your commentary on this. I am seeing an explosion of what I believe are individuals that are paid by large industry to
Yep.
come in and push back against this narrative. And some of the things that I'm hearing is that aluminum adjuvants are perfectly safe. And you know what? If you don't think aluminum adjuvants in vaccines are safe, then that means you don't think breast milk is safe, because there's low amounts of aluminum in breast milk. And what they're referring to from that is aluminum is actually a naturally occurring element in our soil. However, it is bound to other compounds that really limit the bioavailability. And I have been surprised to see so many pediatricians and other healthcare professionals get online and say things like the minuscule amount of ionic aluminum that's bound to other compounds is basically the same thing as taking aluminum hydroxide, which by the way hasn't been safety studied, and injecting it directly into the bloodstream. What is your feedback on that
Yeah.
from the pharmacist
Yeah, I
perspective?
got a lot to cover on there. So, and what they're referring to is the elemental aluminum, so the amount of aluminum when it's in a compound. But when it's in a compound, it dissociates still into the separate aluminum ion. So when it's going into the blood, it's dissociated as that aluminum ion, but then it also then binds, 90% binds to transferrin, and then about the other 10% is usually citrate. When that transferrin and citrate carry it, or they're transporters throughout body. Um, and the difference between oral injection is huge. You can't, those are not apples to apples. So oral ingestion, the bioavailability, or the amount that gets into the blood, is about 0.1 to 0.3%, whereas intramuscular is going to be 100%. Oh, it may be not all at once, but over time, that is the amount coming in, going to the blood. So you have 100% versus 0.1 to 0.3%. That is significant difference. So, I mean, another way of saying that would be is if you had 1,000 micrograms of aluminum ingested orally, you're getting about 1 microgram into the blood and distributed throughout the body. Whereas if you're getting it intramuscular, that's 1,000 micrograms. So 1,000 micrograms is 1,000 micrograms into the blood. So there is a significant difference there between oral ingestion. But of course, like any exposure, to me, I want to eliminate as much exposure as possible. I don't want a neurotoxin in my body. And it is surrounding us. So it is, it is in our food, it's in our meds, our water. So we do need to watch that as well. But you can see why, the intramuscular formulation is more of a concern than oral, just because of the higher amount that's having opportunity to distribute throughout your body and accumulate.
Yes, and I'm very disappointed that someone can get through medical school and not understand that. Like I have no words for that. And I will say, once, a long time ago, I was an ignorant, indoctrinated nurse. But I will say, when it comes to the vaccine schedule, as soon as I saw the comparison between what I was given, what was on the schedule when I was a child, which were 24 doses, and then I saw the schedule today, 72 doses, that's all it took for me to look at that and go,
Right.
"Oh, okay, I'm
Yeah.
wrong. I need to go do my
Yeah.
research." But it is very,
Yep.
it's very disappointing, and it's shocking to me the amount of professionals that continue to dig their heels in and will not even, I mean, I'm kind of like, can we put on our critical thinking caps? Well, we're
Yes.
about halfway through the show, so we're going to need to cut to break soon. And before we cut to break, I do want to remind all of our listeners, if you are a nurse and you are fed up of the sick care system, I have a solution for you. I can absolutely train you at the Functional Nurse Academy, which it is the most comprehensive functional medicine training on the market, specifically designed for nurses. And all of our graduates get 90 CEUs, board certification, eligibility, business mentorship. If you'd like to learn more, be sure to check out functionalnurseacademy.com. This show is also syndicated on America Out Loud Talk Radio, on the Nurses Report radio show and podcast. So you can also find me there on any major app. Hello and welcome back. This is your show host, Melissa Schreibfetter. Today, I am joined by Michaela Wachal, who is a clinical pharmacist and is training in functional psychiatry, functional pediatric psychiatry. And she also is incredibly courageous because she has been speaking out about certain shortcomings that are recognized as safe in the conventional medical model, such as aluminum adjuvants in vaccines. And we're also going to cover Tylenol a little later on in the show, but welcome back, Michaela.
Thank you.
So we were just talking about bioavailability, and it is, and I mentioned about how I'm still hearing, and you're probably hearing the same thing. Like I have friends and other family members, and they say, well, my pediatrician said the aluminum that's in the vaccine, it's no more than, what a baby might get through breast milk. And we've debunked about how that's not true. And
Right.
also there's consequences to these things. And you did a really great reel on Instagram where you were talking about how aluminum can cause phosphate deficiency. I would love to hear more about that and like what the repercussions would be of phosphate deficiency.
Yes. So, and I'm not going to remember exactly the mechanisms here as I'm doing my research. I write those down and review them. Um, but basically, there's a way through the kidneys that it is preventing the absorption of phosphate. And there's a few different mechanisms of how it does that and can deplete the phosphate. And I thought it was interesting because I did a hair mineral test for my son and it came up, high aluminum and there was also low phosphate. And so I was like, oh, I want to see if these could be connected. And sure enough, um, yes, they can be. And so my thoughts there was if you can lower the aluminum burden, then you'd hopefully see that phosphate regulate. But phosphate, is, as we know, for phosphorylation and other processes is critical to the body, um, and can have repercussions as well. And then, I mean, besides that, there's just numerous effects that aluminum can have. The main one is going to be oxidative stress. And so specifically superoxide peroxidase. And oxidative stress just overall in the brain has significant impacts. It can cause DNA damage and impair protein function, alter neurotransmitters, mitochondrial dysfunction. It can damage the blood-brain barrier, impair, your synaptic functions. This drive inflammation overall, can lead to apoptosis or cell death. That's just all from oxidative stress. So that's just one mechanism of how aluminum can disrupt our biochemical processes. Besides that, it can activate inflammatory cytokines. So specifically, tumor necrosis factor alpha, interleukin beta 1 beta, and interleukin 6. So different inflammatory markers or cytokines. In the gut, it can affect the tight junction proteins. And then increase the intestinal barrier permeability. And so when you do that, that opens up the permeability for bacteria, toxins, undigested food particles, things that shouldn't get through are able to get through then and into your blood. And so that, again, another important mechanism of how it can disrupt our biochemical processes. I looked a lot at methylation, because methylation is critical for everything in our body, for every function. And so to have methylation impacted and leading to like hypomethylation, that can have such negative consequences. And then you throw in individuals that already have genetic susceptibilities to that methylation pathway, like an MTHFR mutation, or COMT, different things where those pathways are already affected. But aluminum can also directly impact those through also like histone disruption and methionine synthetase, leading to abnormal phosphorylation, which we talked on. And it can also bind directly to DNA, to the phosphate group, and cause direct DNA damage. So that can cause chromosomal instability and impaired DNA repair, which would actually put it in the class of being a carcinogen. Now, all the studies I've reviewed, most of them are studies in mouse models, and so they can't be directly transferred into human studies. But typically, when we have studies like that in mouse models, that's what gives us evidence to look for or do further studies or do in humans for safety. But instead, for some reason, aluminum gets a free pass. Like, oh, it's safe. Yep, no neurotoxin, no poison. It's not safe. There's no evidence of it being shown to be safe. And then you have all these mechanisms showing potential harms. So there's all that. There are a few studies where the amount of aluminum content was looked at in brain tissue of deceased donors that had Alzheimer's, autism, and multiple sclerosis. And so I have to say a big shout out to Dr. Chris Exley. He's a chemist in the UK, and he has studied the effects of aluminum on living organisms probably 30 plus years. And he's been trying to warn us of the harms of aluminum, but he's been censored, suppressed, and and then if you don't get funds for research, it kind of shuts that down. But his research showed that levels of aluminum in these deceased brains of individuals, also autism, Alzheimer's, and multiple sclerosis, particularly, the study showed, well, for one, he did some with silica water. And so the silica water, it showed that may be an effective way to decrease aluminum in the brain or in the body because it binds to aluminum. And when the study with MS patients, they measured aluminum concentration in the urine for 2 weeks and then measured it the following 2 weeks when drinking 1.5 liters of silica water every day. And the aluminum concentration in the urine in drinking the silica water was significantly higher. Right. And so what this told me is, one, that these MS patients on that baseline all had higher aluminum concentrations. And then that second part of that is that they had higher concentrations of excreting it when they were drinking that silica water. So That was some evidence that he gave us to on what can we do about high aluminum content in the body. That's probably the best evidence I've found for, I guess, removing that aluminum burden in the body. But of course, we need so much more research here to confirm that and to compare other agents that may like chelate the aluminum for removal.
And that is something and so as you are talking about that post-mortem study and about how they found very high levels of aluminum in the brain tissue of these patients, that is a huge red flag. That is something that like,
Yeah,
hey, this is serious because we are literally
really.
injecting aluminum into so much of the population. And, you know, and on the other side, people will say, oh, that study was small. And it's like,
Right.
yes, it was small. We need to do more research on this
Right.
because this is very
Exactly.
serious.
You don't just ignore it. I mean, you don't just ignore that we have that evidence. I mean, it's the highest content of aluminum in human brains
How did it
ever
get there?
reported in autism, and
Well,
it was in all of them. So,
yeah.
I mean, how do
And
you just ignore
again, yeah, yeah, and again, with aluminum exposure, when we go back to that bioavailability, okay, injecting aluminum hydroxide into the body, especially when the CDC was FOIA'd and they were asked, hey, please provide safety documents in the use of aluminum adjuvants, and they replied back saying that they didn't have any available. So it really is a big deal, especially when we have individuals who start having neurological disorders, autoimmune disorders, and then we continue to inject them with products that contain aluminum. I mean, this is really an ethical issue.
right?
And again, it is a neurotoxin. And back to the detoxification element of it. So I think that's very interesting what you said about the silica water. And now whenever and again with functional medicine, many times when we have studies on certain herbs and other natural remedies and things like that, you know I joke about when we're talking about natural things. Big broccoli is not going to come in and drop like multi-million dollars on a randomized, controlled, double-blinded placebo, right? And
Mhm.
but again, going back to something like the hepatitis B trial, less than 150 people, and no no saline placebo, and a product that can be very harmful. A lot of natural things are actually very, very low risk. But when we see studies on them, they're much smaller studies.
Right.
However, the conventional system will just completely poo poo it because the studies are small. But something like
Mhm.
silica water, can you touch on the safety of silica water?
Well, I wouldn't say we have large studies, of course, to support the safety of it, but it's a mineral water. So, I mean, if you think of even, I look at it as the people in those blue zones, for instance, that are living longer, they are surrounded by silica-rich water, mineral water. Um, and so it's hard to say that something in the water like that, what level it would be, it would not be safe. But it does show to bind aluminum and help with that excretion.
And what's interesting about this is, you know how I was talking about how aluminum is a naturally present element. It's naturally present at very, very small levels in the soil. But I was talking about how it's bound to all these other compounds. Okay.
Yeah.
And one of the compounds is actually silica. But then what do they
Mhm.
do when they create these aluminum adjuvants? They strip it from those other compounds. So that makes a lot of sense to me.
Yeah.
It is naturally bound to silica. So when we get very small amounts of aluminum in our food, it's also bound to those compounds, thus significantly reducing the bioavailability. So the body's not
Mhm.
absorbing very much of it because it has that silica and other compounds as a protective factor. But I think that is very interesting about the silica water. Because again, I think there's a lot of people we know that mental illness is on the rise. There's an explosion of autoimmune disorders. I mean, when I was a kid, I did not know of anybody with an autoimmune disorder. We have all of these allergies, and there's so many different associations between aluminum and all of these different things. And in general, I think it is important for people to understand how to support their drainage and detoxification pathways and things like that. And another thing to kind of bridge into something else, there's been a lot of controversy about Tylenol, and one of the things about Tylenol is it significantly depletes glutathione, which to our listeners, that is your body's master antioxidant. It plays a very important role also in detoxification. And you also had some interesting research about the dosage of Tylenol in regards to pregnant women. Can you tell us a little bit about that?
Yes. Well, and that announcement came up with involving Tylenol, and everyone, was talking about Tylenol and, oh, it could it possibly contribute. So I was like, oh, I got to look into this. What are the actual mechanisms, or could it be contributing? And well, when you look at Tylenol's pathways, it gets metabolized to a toxic metabolite, or there's one of the pathways that gets metabolized to that toxic metabolite, NAPQI, and then removal of that toxic enzyme, like you said, is dependent on glutathione. So it eats up glutathione, which decreases the amount available to detox other toxins. And so if you've encountered other toxins, like let's say vaccines, for instance, have aluminum, which would be a toxin that creates free radicals or oxidative stress. That glutathione would typically neutralize those harmful free radicals, bind to aluminum for excretion. Um, but when it's depleted, it's not facilitating the removal. And we know, like we said, we know aluminum accumulates in different organs and tissues. So it's kind of, in a way, taking away a defense system. And then in infants, when we look at dosing, so if you look at any of the infants, it's, dosing, let's say 10 milligrams per kilogram per dose for like a 2-month old. But mom can get a max daily dose that's about 15 times a dose a 2-month old daily limit would be. Yet we know it crosses the placenta in some because it's been shown to be in similar concentrations in the maternal and fetal blood. So I mean, that's just that alone, you have mom taking potentially up to 4 grams, and it can cross the placenta, and the fetus is potentially exposed to that same concentration. Those doses, I mean, they don't add up. They don't, it's no wonder. It's like, okay, so you're giving a much higher dose to that fetus is exposed to, depleting their glutathione, and then we hit them with a shot of toxin. I mean, it's adding insult to injury.
So I remember, so my first job at a nursing school was in pediatrics. And the first thing I would do in the morning was I would look up all of the ordered medications, and then I would have to compare that to the weight of the child to ensure that, because we would always double check
Yeah.
everything because dosing is so, so important. That is very alarming to me that the agencies that are setting the standards for the appropriate dosages are not properly doing their homework, and there's errors in that's very
Right.
alarming. And
Well, then you oh,
go ahead.
I was just gonna say, and then you take into even other factors that aren't considered in that. So the enzymes, the CYP enzymes, are developmentally immature. And then there's genetic polymorphisms where there's enzymes influencing, how quickly or slowly a substance is metabolized. And so those are other factors not even taken into consideration. And I think it was the American Academy of Pediatrics, or no, American Journal of Obstetrics and Gynecology. They showed that so Tylenol appears in the maternal and fetal blood at similar levels as soon as 30 minutes after a dose, and that remains fairly constant for about or until about 3 hours after. But then around 4 hours is when you need another dose. So even the American Journal of Obstetrics and Gynecology has that it's in those similar levels between maternal and fetal blood.
And I also think that there is just it's really hard for parents right now. There's so much conflicting information because and I remember when I had my first child, I believed the pediatrician is the expert in
Yeah.
pediatrics, and I really believed everything that they were telling me. And then also, I am seeing, I need to just like take a fast from social media because I will see things being posted and I am like, oh, this is awful. But I have a little bit of propaganda that I would like to read. So I had this is a post I saw from again, someone who I think is so, so well-meaning, and it is from the unbiased okay, it's from the unbiased science, which seems pretty biased to me, but anyway, it has all of these myths about, here's a 10 vaccine myths. Myth number 8 says, aluminum in vaccines is toxic. And then they go on to educate us about how safe and effective aluminum is. It
Mm.
says, and this is what parents are reading, aluminum salts, so that makes it sound better. Aluminum salts are used as adjuvants in some vaccines. These are substances that help the immune system respond more effectively. Injecting aluminum directly does indeed enter the bloodstream, whereas is in food and water and is mostly not absorbed. Oh, I'm sorry, say that again. Injecting aluminum directly does indeed enter the bloodstream, whereas aluminum in food and water is mostly not absorbed. But the amounts in vaccines are far below established safety thresholds, and they
No, they're
have
not.
been shown to be safe and are formulated so they don't flow to the bloodstream. Large studies, including a nationwide study in Denmark involving over 1.2 million children, show no association between aluminum containing vaccines and autoimmune, allergic, or neurodevelopment conditions. Would love
And
your.
like, and I
Well,
talked, yes, and I
yeah,
talked
go
about
ahead.
that Denmark study because I actually reviewed that study.
I did too.
And I was just, that just was so frustrating because they didn't ever study no aluminum versus aluminum. It was increments of aluminum, like point 0.1, point 0.2, different amounts of aluminum in these age groups. And there were so many issues. I think they took out any patients that were less than 2, which right away completely eliminates any link to SIDS because they just removed them. I don't remember what all the issues were, but that statement alone, there is no comparison of no aluminum versus aluminum. And then actually they corrected the study. I think it was like 2 days later, or a few days later, they actually corrected the study and the data showed significant correlations. But then no one talked about it. No one talked about that because they had already got the media hype off that it doesn't cause autism. That's not linked. Is that what you had read too?
Yes, yes. Well, I understand good and well that this is a typical big pharma trick, is they will do a large study and they will compare basically 2 groups of people that had the same thing. And then I saw another propaganda post about the hepatitis B vaccine, and they were like, there was this huge study that showed that there's no harm, and they did comparison, but then you really want to pay attention to how these individuals are speaking because the hepatitis B vaccine, they compared people who got the hepatitis B vaccine to people that also got the hepatitis B vaccine. But it's always like they get the same product, but it may be a different timing or something. And then they blow it
Hmm.
up and they're like, oh, look at this study. And honestly, the individuals, the organizations that do this, they think that their followers, they think that their audience is stupid, and they think that the audience is
Yeah.
either too busy or too stupid to actually click on the study and read the study. But I see a lot of
Yep.
that getting shared, but I do think that the industry is not real happy right now because, more than ever, I mean, post-COVID, people are actually there's so much more talk about this, and then through social media, they cannot control social media, and the information is getting out there, but usually when I see that type of propaganda and I do research into it, I see that there's some type of pharmaceutical funding.
Oh yeah, it's usually pretty obvious once you dive in and look at it. And what's frustrating to me is that what's being covered on mainstream news that maybe our parents would be watching isn't covering any of the other side. But they're only hearing the one side of, oh, there was no cause or there was no it was shown to not be associated. So they're only hearing one side because a lot of people aren't on social media. So that's what is extremely frustrating to me about the censorship and suppression on just our mainstream news media. But that's why I feel like it's so important that we get it out there and we do share real, like the actual evidence. And Aaron Siri, he's just phenomenal. The lawyer that has all the evidence on these studies to show to actually breaks them down and shows us that there's no inert placebo. And what's frustrating is these manufacturers in their studies state placebo when it's complete. It's complete fraud, honestly, because it's not an inert placebo. They took vaccine versus vaccine minus the antigen, where everything else was still in there. So you still have the aluminum, you still have the polysorbate or whatever inactive ingredients are in there into the study. So, of course there wouldn't be any difference because you're still having the effects of the inactive ingredients. And so if it's aluminum causing harm, you would never know because there's aluminum in both. So it's just the knowing the definitions and the verbiage and how they manipulated that data is it's unreal to me, because now we're in the situation where really we don't have any true safety studies for childhood vaccines when you think about it, because they didn't use a placebo.
And it is, and again, you kind of learn, it's the same playbook over and over with the changing of definitions. You can't just give in the placebo group, you can't just give them another vaccine and then just call that vaccine a placebo. And then same thing with Aaron Siri. He's done amazing work, but when you're doing amazing work and you're speaking out about these things, you will be smeared. So he is smeared all over the place as this like anti-vax conspiracy theorist attorney. But again, remember, the definition for anti-vax has been changed for anyone who opposes mandates or has any questions concerning the safety, which honestly is most of the country by now. But that's about all the time that we have. And I know that our listeners are going to want to follow the great work that you are doing. So what is the best place for them to follow you?
Yeah. So currently, I'm posting my findings and research and educating on Instagram through your clinical pharmacist. Michaela Wachal. Sorry that's so long, but I think if you just search your clinical pharmacist, should be able to find it. I was doing TikTok for a while, and when I did TikTok, I actually got kicked off for doing posts about vaccines. So I was like, I don't want to really go back on there and get kicked off again. So I was just focusing on Instagram to get education out there and bring awareness and advocacy. And in time, I may have some different things available and services, but right now I'm really focusing on learning everything I can to help other people.
Wonderful. Well, thank you for all of your courageous hard work and your voice in this really important time, and would love to have you back. That is all the time that we have today. Thank you so much for tuning in. And again, if you want to learn more about the Functional Nurse Academy, please feel free to register for our next live webinar, and you will see that link in the show notes. You can also check out Functional Nurse Academy on our social media platforms or on our website at functionalnurseacademy.com. Until next time, be safe, be well, and God bless.